Well, welcome everyone to our Mental Health Ambassador Program induction and welcome back ceremony. We are so thrilled to be inducting our third set of mental health ambassadors this afternoon. We have a full agenda for today. As you can see here, Dr. Stowe and I will be doing a welcome, and then very thankful to be having opening remarks from our deans, Dr. Kennedy, Assistant Vice President for Student Health and Wellbeing, Dr. John Jones, Vice President for Student Affairs, and we are so thrilled to have Juhi Agarwal, who was co-founded Mental Health Ambassadors with us. And then we will move into doing a brief history about Mental Health Ambassadors, talking about our initiatives and the leadership team. And then we will have each of our leaders sharing about the specific initiatives, and then moving into talking about recognizing all with our induction and doing our team selection, and then next steps and closing remarks. So a nice full agenda for today, and honoring all of you for all the wonderful work that you're doing. So first, let me say thank you, thank you, thank you, and welcome to our 2022 Mental Health Ambassador Induction Ceremony. We just feel so fortunate to have you. We have all of our existing members joining us, thankfully, and are excited to welcome you. Dr. Stowe?
Yeah, good afternoon. Thanks everybody for making time out of your very, very, very busy schedule. We know that you've made this a priority to be here. I'm delighted to have our special guests here as well. You've all worked very, very hard to be at this place right now. You've completed many hours of training. You put a lot of thought and consideration into an application process, and you've made a commitment to be committed to mental health promotion on our campus. And so we are honored to have you here. And this is a really important and special event for us as well. So we welcome you tonight and look forward to it.
Thank you. So I will invite Juhi Agarwal to share a few words of opening remarks. I have to just give such great appreciation to Juhi, who serves as our co-founder with Dr. Stowe and myself. She graduated from UAB right during this very first year of us founding this during the pandemic, and really just helped help with the vision of mental health ambassadors. And we would definitely not be who we are without the great commitment and insight Juhi. So Juhi.
Thank you, Dr. Lindsay, for those kind words. And it's so great to be back here today with you all. I just also wanted to welcome you all here, welcome back members who have been in this program for several years, as well as new members. It's really exciting to see how this program has grown since we started it in fall 2019. And even at that time, there was such interest, but now to see how much more it's grown in terms of people, initiatives, and impact is really remarkable. You should all be really proud of yourselves for being a part of this program and for making a difference in how we talk about mental health and how we understand mental health on our college campus. You are really making a difference. And yeah, it's just really great to be here.
Thank you, Juhi. So appreciate you leaving your mark here for sure. Continuing to be a mental health champion all the way across the country as you pursue your medical degree. Dean Blanton, Dean of the Honors College. And again, I must thank you for your vision and the opportunity to have this as an original Honors College Faculty Fellows program and your continued commitment to the program. Dean Blanton.
Well, thank you, Dr. Lindsay, and it is truly an honor to continue to partner with you and Dr. Stowe and all of the mental health ambassadors on this really important program. I'm really happy to join you this evening to be with you and my esteemed colleagues for this Mental Health Ambassador induction. It's great to get to share a lot of time with you guys, such a dynamic group of students and colleagues who are shaping and changing the narrative on mental health, particularly in terms of its impact on student health. And Dr. Lanzi, here again, just want to thank you so much for your work as an honors faculty fellow in developing this program and your commitment to continuing it, we hope forever. And Dr. Angela Stowe of the Student Counseling Services for your vision, commitment, and passion that has led to this unique peer-to-peer mental health promotion program. And Juhi, what an honor to be with you tonight. I'm so glad that you could come back in because Juhi was so instrumental in the start of this program. You all have worked to learn more about mental health and to become equipped to carry out this program's mission and initiatives to destigmatize the concept of mental health and promote overall health awareness. As Dr. Lanzi pointed out, when this program was begun in 2019, we didn't even have an awareness of the pandemic. When I first heard about it in March and Dr. Watts said to me something about the pandemic, it was really kind of hard to process. And I would say even before the pandemic, we knew that this sort of program was very much needed and would be important. But certainly after the 2 years that we've experienced and all of the tremendous stressors that people have dealt with, it's all the more valuable and timely. You educate us about mental health, offer a sense of community and belonging, and provide ways for managing stress and ways to seek help. To the mental health ambassadors, those who have been ambassadors and those who are being inducted tonight, I want to say I'm very proud of you, your accomplishments, and your interest and commitment to promoting good mental health. I urge you to continue to make a difference in the lives of others. You are shining examples of what we say in the Honors College of how to set your world on fire. And I thank you for your commitment and contributions. So thank you very much for allowing me to join you this evening, and best wishes. Dr. Lanzi?
Thank you so much, Dean Blanton, for your continued commitment and your beautiful words. Thank you again. Dean Irwin, I welcome you, Dean of the School of Public Health, and who admire and all that you do and how much support that you have given from the very beginning for Mental Health Ambassadors Program. Dean Irwin. He, as we said, may not be here quite yet. I know he is planning to be here, and as Dr. Kennedy just shared, that we are in a pandemic, and as the School of Public Health Dean, he is often called to come to quite a many meetings. So we will invite him to share as soon as he is able to rejoin us. Dr. Kennedy, Assistant Vice President for Student Health and Wellbeing.
It's such a pleasure to be here tonight. Folks probably don't know me. I've been here about 2.5 years, and I am a licensed psychologist. And so, of course, the work that you're doing is unbelievably near and dear to my heart. I think that it is critical for students to be involved in this issue. And it's difficult sometimes with everything on your plate and all the different ways to get involved to make a decision to have this be sort of the thing that you really pour your heart and soul into. And so I'm really, really grateful to you for your service, because this is not something that we could do. We can have lots of wonderful staff and therapists and mentor folks in all kinds of different ways, but we just can't provide that pure peace. And so, yeah, so grateful to Juhi for co-founding this and bringing this here, but then also to each of you for answering this call and deciding that, this is something that you really want to do. I love this quote we have here in the LRC. If you haven't seen it, it's an Ernest Boyer quote, and it says, "Wellness must be a prerequisite to all else. Students cannot be intellectually proficient if they're physically or psychologically unwell." And it's so true. I mean, that's the whole reason that health and counseling centers have come to universities, is because they realized that if you're not doing well mentally or physically, you can't be successful academically. It's impossible. And your health has to come first. And so if we can, as a university, help you sort of in terms of those things, that can, remove one of the barriers to being successful with sort of really reaching your goals and your dreams. So that's what you're going to be doing. You're going to be helping individuals, succeed here at UAB by being able to really give them those tips, give them that support, point them in the right direction of all the resources. There's so much. Again, you're in those conversations. You have the status of somebody that they would listen to, in terms of, yeah, I've been there, I've struggled with that, or I've been to this particular office, or here's a person you can call, or here's a mentor that I've used. All of those kinds of things coming from you it just has a different meaning. And so I'm unbelievably grateful to you for your service, and so delighted to be here, and just want to thank everybody for all that they're doing on behalf of UAB.
Thank you, Dr. Kennedy, so much for your continued support. It's beautiful to see at so many high administrative levels to the support that you have for this work and encouragement. Dean Irwin, Dean of the School of Public Health.
Hey there, I apologize for being late. I was trying, I was on I guess an old on a Teams meeting link and did not have the updated Zoom link. So my apologies for being late. Wow. First of all, I have spent some time looking through the slides that all of you are about to see. And the first thing that strikes me is just what an incredible breadth and depth of accomplishments you have experienced and have cause to celebrate. I just want to express my very deep gratitude to Dr. Lanzi, to you, and to Dr. Stowe, to Dr. Kennedy, and to all of you who are supporting this work, to Dr. Dean Blanton and Dr. Jones. I can't tell you how many times over the past several months in my interactions with students, both in and outside of the classroom, issues pertaining to mental health have come up. I was co-instructor for a class last fall with Dean Emeritus Max Michael, and this was with upper level undergraduate students and one graduate student. And when students decided what topic during the semester they wanted to focus on, several students wanted to focus on mental health and the impact of the pandemic on the health of the mental health of students. One of the things that I do, in addition to serving as Dean of the School of Public Health, is that I'm an associate editor at the American Journal of Public Health. And just looking at the number of submissions that include a focus on mental health and COVID-19 over the past several months is just overwhelming. Just prior to joining in, let me see if I can pull this up. Well, I can't share my screen, but that's okay. I'm looking at a manuscript entitled COVID-19 Isolation and Quarantine Experience for Residential Students at a Large Four-Year Public University. And this was a manuscript that I handled as an associate editor. And the focus is from the University of Virginia in Charlottesville. And there are a number of students who helped to write this manuscript. And I will put the link to the article in the chat, because I think it's a great representation that the kind of work that you've been doing is incredibly important in terms of mitigating and preventing the impact of COVID-19 on the mental health of your fellow students. So again, I want to thank you. This is critically important work that you're doing. You're saving lives. Believe me, you're saving lives. So thank you. I want to thank all of you for this.
Thank you so much, Dean Irwin. And again, thank you so much for providing your continued support throughout from the beginning of this, when it was just an idea, to now when it has become, and your continued not just moral support, but financial support for this as well, along with Dean Blanton. We appreciate that so much, to allow for the sustainability of this, along with student affairs. So thank you. Dr. John Jones, Vice President for Student Affairs, we're so very thankful to have you here, and we know how busy you are and how much you have on your plate, so thank you.
Dr. Lanza, first and foremost, thank you and the work that you do to make the UAB campus community an incredible place to be. Certainly, I'm very proud of the work of our ambassadors to better serve our student population. Certainly, they're not only incredible students, academic students, but they also are incredible ambassadors and service leaders that role model the behavior that students, faculty, and staff at the campus should emulate. So certainly incredibly proud of them. And again, thank you for the opportunity to be a part of this ceremony.
Thank you again. And I just have to say to our ambassadors, how amazing is this, that we have on a 5 o'clock in the afternoon on a Monday during a pandemic, you have the deans of the dean of the college, Honors College, the School of Public Health, Dr. John Jones and Dr. Kennedy here to share their endorsement and their support for our program. And so just so very thankful for that and for you all. So Dr. Stowe and I thought it might be nice to share just a very brief history of the mental health ambassadors and a brief overview of the initiatives and our leadership team. So as we've been saying, the Mental Health Ambassadors Program was originally launched pre-COVID in the fall of 2019 as the Honors College Faculty Fellows Initiative. I'll never forget, that spring of 2019, I taught a mental health seminar in the Honors College, and it was so on my heart, all of the mental health concerns that were coming up. Again, this is pre-pandemic, and just how committed the students were, but just how much they recognized they wanted to do something for students by students, and was so very fortunate to have such a great working relationship. Well, and now I have to say a great personal friend in Dr. Stowe, and her just coming on board. Yes, absolutely. And I have to give her the credit with coming up with the ambassador word for this. And you all are such great ambassadors. And Juhi, who was my TA at the time in the mental health seminar in the Honors College. And it was an amazing kind of just organic process that came from this. And so here is just a brief graphic of how the Mental Health Ambassadors Program, it started as and continues to be a peer-to-peer mental health promotion program. And I have to give Dr. Stowe and Juhi too this awareness of sort of making it these 3 areas of mental health awareness, self-care, and resiliency, and really wanting to be able to convey what are mental health concerns and what do we need to know about mental health, and then moving into taking care of ourselves and how do we practice that, and showing resiliency and what does that look like. And so we started out after our after all of the students were trained through student counseling services, and focused on initiatives in terms of social media, presentations, and events. And again, that started in the spring of 2020, right as the pandemic hit. And we were so fortunate to have the ambassadors just really embrace this opportunity to pivot and offer daily, Monday through Friday events online. And Dr. Christine Hertz-Weisscheck, the Associate Dean for the Honors College, offering a lot of meditation classes, partnering with UREC for them to lead yoga for us, the artists in medicine, and partnering with us as well. So it was such a nice embracing of community at all levels into supporting our student population. And then moving into the fall of 2020, our coming within from the students asking, can we do a podcast? And so that has been so beautiful to see the development of the podcast, Archive, Our Lives, Our Journeys, Our Stories, and both students and Dr. Stowe and myself, Herb Wilkerson, who is a student counseling services counselor, and sharing on the podcast. So that has been a beautiful thing to witness. And then outreach began as a very concerted initiative for doing outreach. This past fall in 2021, we grew and started launching an Instagram Live. So that's been really fun to witness, really embracing all ways of reaching out. And then developing, as we've grown so much, having the need to have a team dedicated solely to conducting, overseeing the training, our members, and recognizing our own mental health ambassadors need their own professional development, their own, let's support them as well. So dedicating time to each of our meetings, general body meetings, to professional development for our own mental health ambassadors. And that's been beautiful to see. And we are so excited to this spring to be launching a graduate student team focused on our graduate students in terms of mental health ambassadors, and excited for all of that to come. So very thrilled to have that. It's amazing to see the growth that we've had in terms of those who've been trained. We have, it just continues to grow. This past fall, having over 150 unique individuals attending the trainings. And how beautiful is that they, so many students want to be trained and are embracing the training by student counseling and being champions on campus and giving of their time freely to do this. And the reach that we've had has been phenomenal, with over 1,500 documented students, and really faculty and staff now extending beyond just our students. And of course, this is a peer-to-peer mental health promotion program, but I have to say, as a health behavior scientist, somebody in public health, that it's not just the students that we need to reach if we're going to support students. So really looking at all facets of supporting our students, and it's been amazing to witness. And so I want to recognize all of our leadership here. And again, I'm so very thankful to Dr. Stowe as our co-founder. And I think one of the beautiful things that we have, and something very unique to our university here, is having a clinical director, somebody who is partnering here. And, I am a developmental psychologist, but I am not a clinician. And the fact that we are able to really link arms together, having the clinical practice along with a public health practitioner together to implement this and see it from those dual lenses has been amazing. And just the commitment from Dr. Stowe, who gives up her time really outside of her clinical work here. So I'm so very thankful for her, and she's just got such an amazing just creative brain to do this. So Dr. Kennedy and Dr. Jones, thank you so very much for that, having Dr. Stowe with us. And so as you can see here, we have our presentations lead is Madeline Cook, who has been with us since the inception, and she is graduating this year. I will have to say thank you to Dean Blanton. That reminds me that she is allowing our leaders to be part of the medallion ceremony for the Honors College and really helping elevate these leadership positions and recognizing the role that they've had. So thank you for that, Dr. Blanton. Our events lead is Juhi Agarwal, and she has also been with us since the inception. So very thrilled. Our top row here have all been with us since the inception. Destiny Cravens is our communications coordinating lead. And so she will be graduating this year. I have to give a shout out. She is also getting her MPH in health behavior, and love having her in my capstone course this semester. And then our outreach lead is Lavonia Joshenkar. She has been with us since the beginning, although she's not graduating this year, so we get to have her for another year. And then we have Alex Jones, our podcast lead, and she's also been with us since the beginning and is graduating this year. So our next two are Caleb Sanders, who is launching our IG Live, and excited for his continued growth in that role. And Tasia Williams, her is leading the professional development membership and training. We're trying to get really creative with that. It's a very wordy title, but very descriptive of what she's doing. And then we are very thankful to have Mercedes Tarasevich as our graduate student lead, and who studies suicide as part of her doctoral work in medical sociology. So very thankful for our team here. Dr. Stowe, would you like to share anything else?
You'll get a chance to hear from each of these amazing leaders in just a little bit more about the teams and more about what they do. I guess that's next. So yeah, what we want to do is we gear up our new leadership for being a part of the mental health ambassadors this spring, as we want to give you a really good overview of what to expect, because you're going to be asked to pick what team you'd like to serve on. And so, and now we also can give each of the leads a chance to share more about what they've done. And so we'll start off with Dua. You want to start and share about events?
Hey everyone, thank you for coming. My name is Juhi Agarwal, and I'm the events lead for the Mental Health Ambassadors. Really, our team focuses on events. We shifted last semester to doing Let's Talk events. These are like discussion based. It's open discussion where we have like the first 15 minutes discussing a topic. In the past, the group has presented on academic distress. We've done positivity and coping through times of stress. We've also done Into the Unknown, which was a little bit about the pandemic. And then not knowing kind of how our future is going to look and how to cope with that. And then we have like a discussion with questions and just kind of seeing to help people see that, okay, I'm not the only one going through some of these things. Our team members who participated last semester were Rashmi, Naki, Ezka, Zuha, and Morgan. But I am looking forward to having more people on the team this year. And the group members are a little bit more fluid. So if you do want to be a part and you're on another team, definitely let us know. And, you know, if you don't want to be part of the people planning it, you can definitely join. We'd love to see you guys. All right, expectations of team members, just helping with all aspects of planning. So last semester we had hot cocoa. So someone went out and got the hot cocoa, and then we had PowerPoint presentations that we prepared, questions that we prepared, and then just kind of running through it. So a lot of it is advertising ahead of time. So different group members will have different roles within that. And we're planning to have one event per month in the semester. So we'll have a February session, a March session, and an April session. And each one will follow the theme of the month that we decide. And then just keep up with us through GroupMe or meetings. It'll be either just meetings or check-ins. And that's really the bulk of it with expectations. So what we did, like I mentioned earlier, we did the Let's Talk sessions last semester. We got some cool mugs. And so that's from the session that was the week before finals. It was part of the Stress Less week. We had a pretty good turnout, so it was pretty great. We also in the past did MHA, in which we kind of did like a Zoom call, talked about a lot of different things like self-care strategies. We had a Make It Stick team, which was from the beginning, and some of the members are on here. So that kind of was our initial project coming into Mental Health Ambassadors. And it was about newsletters, and we had an event in front of Stern Library. We also had Wellness Wheel last year and Blazer Buddies, and those were pretty great turnouts. So hopefully we'll see about bringing in different kind of events and see what you guys think about that. I look forward to it.
Thank you, Dua. That was great. We will, in the interest of time, keep moving along. And I will have to say too, that there's been many events that have taken place since the beginning of really March of 2020 that Dua has led. So thankful for all of her work in that area. Okay, presentations. Was Madeline able to join us or?
No, Madeline is sick, so she is not able to join us. I'll go ahead and share in her absence. I'll just say she's worked really hard, and I'm sorry that she can't be here and hope she feels better soon. So the presentations team really does work to identify topics that are in the areas of resiliency, self-care, mental health awareness, a variety of topics, and present more of a workshop where people can go in greater depth learning about a particular topic. Sometimes they also will coordinate guest speakers. Over the course of the last couple of years, there's been a wide variety of presentations that have been offered, and we've done it in a virtual format because of COVID. But even last semester, when we had the option of doing it in person, we continued to offer this in a virtual format to have more people attend. And so it's been kind of nice to have a mix of in-person events last semester with like the Let's Talk program and some outreach events, but then also continue to have some virtual options. The team members that have been working with presentations this year and in last semester in particular, we've got Ava, Courtney, Crystal, Madison, and Suma, who've done a great job. For expectations, really similar to the events team, they're going to look at one presentation per month. And we have been doing these virtually. We'll do at least February virtually and then weigh in and see how we continue that. But they're saved on the YouTube channel, which is a really great way to go back and be able to watch presentations that were missed or go back and see some old ones and share them with other people. And then we ask each member of the team to create and present at least one presentation per semester, and sometimes folks can do more. The meetings really are based on need as far as getting prepared for a presentation. Then they meet in advance to think about the outline and the content, and then definitely meet that week to practice the presentation before it goes live. So the topics are in flux. We have talked about for February a healthy relationships presentation, but then looking to finalize what March and April will be.
Thank you, Dr. Stowe. Go ahead.
Go ahead.
Here's a great example of some of the different initiatives that were done this past fall. And as you can see, there are a wide range here from fitness and mental health. We had a great group of interest in how fitness intersects with our mental health, and another on romanization of OCD. And then really liked how we were diving into looking at different areas of the country, and particularly here in Alabama, and rural mental health. And again, want to reiterate that these are just an example of this past fall. There have been many over the past two years, and lots of great collaborations, as Dr. Stowe was saying, where presentations with others across campus, and presentations on like strategies for self-care while staying at home, and boundaries and self-care. So lots of great presentations and events. The next component is outreach. Lavonia.
Hi, my name is Lavonia, and I help lead the outreach team. So some of our key initiatives include outreaching with DSS. That's something that we'll be focusing more on this semester, and student counseling services. We also help lead the student mental health discussion, which kind of just oversees life surrounding the pandemic, as well as just discussing global events and national events. This semester, as well as like last semester, we tried to focus more on outreaching with minority organizations on campus because there are, specific mental health issues that are affecting specific minority populations as well. And also just general mental health awareness and support. We do this through our posts, Instagram Live, our YouTube channel videos, podcasts, and hopefully this semester we'll be able to do tabling because Dr. Stowe and Dr. Lanzi were able to organize some nice little marketing supplies like pins and stickers. So if we get the chance to go back to in-person events, and that would be one of our general mental health awareness events. After that, so like how will this take place? Kind of like I was referring to earlier, if we get the opportunity to, I think maybe from February onwards, we might be able to do tabling in person. For virtual stuff, we primarily do posts through Instagram as well as outreach events on Zoom. And we also try to send out different mental health resource lists through brochures or just posting it on Instagram in regards to like where people can go to find resources for different mental health issues. So some of the team members that helped participate with outreach last semester, they include Azka, Charlene, Crystal, Mohammed, and Sarah Ann. So some of these members, as Dua was saying, they kind of overlap because members got the chance to, participate in more than one activity. And so this semester, if we get the chance, then you guys will also be able to do more than one because the more help, the better, right? So those are just examples of some of the posts like on the last slide that we helped organize. So responsibilities this semester, we're trying to do at least one primary topic for each month. So as an ambassador, you guys will be required to do or help with at least one outreach event or post per month. And also try to attend at least one event per semester because we love for the ambassadors, to help promote it by being there themselves. For virtual events, these are primarily like Zoom sessions or posts, just helping to plan them or like create the posts themselves. We think for now the meetings will be bi-weekly check-ins. So this would probably occur through Zoom or just checking in through like a group chat or through polls. So far what we planned for the spring semester is that this upcoming month will be, like Valentine's Day and lots of self-love and just love around the community. So there's a week during the week of Valentine's Day for random acts of kindness. So we're going to try and organize something hopefully in person where we can just, spread kindness around the community on UAB campus. So for March, we're going to help plan the student mental health discussion. So this is something that we do throughout just the undergraduate, association as a whole. And we partner with the graduate students as well and other mental health organizations on campus, like Active Minds, just like to discuss different, influences on the students, like impact of different events on the students' mental health and where they can go to for resources, as well as also doing a collaboration with TSS. In April, we plan on doing some tabling because I think by then we should be able to go back to more in-person events. So just general, mental health awareness, as well as national counseling awareness and just, stress awareness. For the next slide. So we've done a lot with outreach because outreach is honestly many things, right? It's presentations, it's events, and it's also just individual, tabling events. So with fall of 2021, we were able to do international mentors outreach, kind of to focus more on like minority organizations around campus, de-stressing events, mental health promotion events, and like Stress Less Week, which is kind of a main thing with School of Public Health. And then last spring, we were able to do stuff for World Mental Health Day promotion, as well as like rec center collaborations, our primary student mental health discussion, and then just like a promotion series where we got to have guest speakers like psychiatrists come in and discuss, you know, where to go for different resources, as well as how you can benefit your own mental health through like different self-awareness techniques or just de-stressing techniques. And then fall of 2020, we just kind of did a general, like, what is MHA, healthy versus unhealthy relationships presentation, some just general back to school mental health tips, and other kinds of like posts that just kind of revolve around where to go for resources, as well as like different topics of mental health. And so below you can see like some of our posts that we did, or promotion posts, such as like with Micah, we had that student mental health promotion series. So she was able to come in and talk on Zoom about the power of peer influence. And then primarily these were like virtual events. So with last year of March, it was, you know, like on Zoom because of the pandemic. So we were still able to do like a coloring and de-stressing event with a bunch of ambassadors, and also just other undergraduate students, and just raising awareness about the different organizations, and, you know, also like the different programs and initiatives that we collaborate with through at Mental Health Ambassadors. So those are, we do a lot, just like general outreach as well as specific with the different initiatives. So that's just a long list of things that Dr. Lanzi and Dr. Stowe helped us create. So it's all thanks to them.
Thank you, Lavonia. All right, social media communications coordinating lead, Destiny.
Hi everyone, my name's Destiny and I serve as the communications coordinating lead for MHA. And essentially what my role is to act as a liaison between the student counseling services as well as all of the MHA teams. So specifically for the social media team, their responsibilities include being in charge of planning, creating, and also developing social media content, not only for the MHA Instagram and Facebook, but also for the student counseling services Instagram and Facebook. And we also are in charge of collaborating with other MHA groups as well as SCS initiatives in order to have an effective outreach. And one thing that is really exciting about this team is that if you are on this team, you will be taught, and also you'll also just be able to develop your skills in terms of social media content production, specifically with LucidPress, which is a software that UAB has access to in terms of branding and marketing aspects. And our current members for this academic year are Tamaya and Sierra. And in terms of responsibilities, each social media group will be responsible for creating about 2 to 3 posts per week as a group. And you will also be responsible for partnering with other MHA groups in order to effectively promote the events, podcasts, presentations, and all of our other initiatives using our social media platforms. And in terms of meetings, they will be based on each group member's availability as well as their preferences. And currently they are virtual, and email communication is also expected. And our past members, we have had a lot, and our past lead was Hannah Smith, so I want to give her a shout out. The social media team would not be what it was without her. And then in terms of past initiatives, we've had Mental Health Monday, we've had Thriving Thursday, we've had Artsy Saturday, which is what I started when I first began this program in 2020. And then we've also had Self-Care Sunday, Mental Health Misconceptions. We've also promoted DSS and its services. And lastly, we've promoted minority mental health and resiliency among different health professions as well. And this slide just shows some examples of some social media content that was created last academic year. So on the left is the Artsy Saturday de-stress post, and then on the right is a minority mental health post specifically about Latinx mental health stigma. And then this next slide is some posts that we've created this academic year. We've outreached for QPR suicide gatekeeper training alongside SCS. And then we've also promoted different mental health days, such as the World Mental Health Day.
Thank you. All right, next is our podcast team called Archive, Our Lives, Our Journeys, Our Stories, led by Alex Jones.
Yep. Hi, everyone. So basically, our podcast focuses on sharing the personal mental health narratives of people from a wide variety of backgrounds. And here's our team. It's me, Caleb Sanders, Tasha Williams, Queenie Simha, and Blair Lane. So each team member is responsible for a certain task, such as team communication, making the flyers, outreach, email and scheduling, social media, posting and advertising, editing, and hosting alternates between team members. And in terms of like meetings, we don't have like set meeting times, but we communicate really frequently in a group chat, and we schedule meetings over Zoom and communicate as needed. Before posting an episode of our podcast, we will meet with that person several times to get a clear idea of what they will be talking about, and we'll create specific questions to be asked in their interview. And we've posted a total of 7 episodes since the fall of 2020. We've interviewed several students, as well as Dr. Lanzi, Dr. Stowe, and Herbert Wilkerson. And the goal is to post at least 2 episodes a semester, but in the future, it would be cool to be able to post like 1 per month. So yeah.
Thank you, Alex. Okay, our Instagram Live team, aka InstaChats, is led by Caleb Sanders.
Hello, everyone. I'm Caleb Sanders. So I'm going to get right into it. We have quite a few team members, myself, Kalaya, Suketha, Vivian, and Rohit, and they all have their own little roles. So what we do, so InstaChats are built to be a very casual way to cover serious topics surrounding mental health. We've kind of developed a little reputation for covering specific mental health intersections, such as holidays, events, circumstances, or things that may just come up in life. We also have a lot of traditions, which isn't very important, but I think it's really cool. We dress up for the theme of our chat, like if it's holiday based or something. So it's really fun and engaging. We also have guest speakers come, like you can see Dr. Stowe in the picture over there, and we engage with Q&A throughout the Insta chat. And the goal is just to keep it casual, promote a safe and comfortable space to converse with others about mental health. So expectations, number 1, just actively communicating with the other team members, staying up to date with your upcoming deadlines, complete any required work for your role on the team, and we plan to record at least 1 Insta chat a month. For meetings, we primarily try to communicate on GroupMe, and then any other meetings that we need to have will be held over Zoom. Full team meetings once a month usually, and for the people who are planning that specific Insta chat, such as the researchers or the hosts for that chat, we'll plan to meet 1 week before the filming date. So what we've done, so this is a new program for MHA, and we're really excited about that. We spent the last semester kind of getting our feet on the ground and developing our format and our planning strategy. It's been really successful. In addition to that, we've also hosted 2 really great Insta chats last semester. Our first one was in October, and it covered Halloween and mental health and how your mental health can be affected by the season. We've also partnered with Student Counseling Services for Stress Less Week, and we held a joint chat discussing going home for the holidays, and they were really fun to do. So I'm excited to do more this semester. So for the spring, like I said earlier, our plan is to host 1 Insta chat a month. And with that, kind of getting some more differentiation with roles and just kind of fleshing out the group a little bit more. Our current plans for topics for the semester, and these are tentative, but for February, we're planning on doing one around self-love and compassion. March, we will be partnering with the Collegiate Recovery assistant director, and we'll also be covering substance abuse recovery. And then for April, we're planning on doing a couple, one for going home for the summer, kind of following our previous theme. And then we also want to do a senior MHA ambassador highlight week and interview our seniors who are sadly leaving us.
Thank you. All right, so for our final team, the graduate student team that we are just now launching, led by Mercedes.
Hey everybody, I'm Mercedes, happy to be here. We have a brand new team for graduate students by graduate students. So we're going to be trying to tailor our initiatives to the needs of graduate students because while those may overlap with undergrad needs for mental health ambassadors, there could be some differences. So we're going to assess what we think we need to do going forward into February. We're going to be trying to connect with GROW, which is Graduate Resilience Outreach and Wellness, which is an existing organization, GSG, which is a graduate student government. The president of GSG, current president, is Jasmine Benjamin. One of her personal initiatives for being president of GSG is promoting mental health. So I think that cross-promoting with GSG would be a good way to go on that, and anything else that's coming up through the graduate school. Because we are so new, our first meeting is this coming Friday, where we will be assessing goals and planning and brainstorming and just getting to know each other. I see a couple of names and faces from emails here tonight, so thanks for being here. So yeah, that'll be this Friday. And then responsibilities. Every member on the team should be either creating or organizing or co-creating and organizing one initiative per semester. So we're going to be doing one per month. Everybody should get a chance to sort of head up an initiative or work on it with someone else as the lead. And then those monthly initiatives and themes and goals are going to be discussed this Friday. And the people on the team are expected to attend regular meetings, stay in communication via email, and then some kind of messaging app, which we'll determine on Friday. There's a lot of tentative and to be determined because everything's this Friday. So looking ahead, we're going to brainstorm and see what we think are the best ways to go for graduate student needs, to see if we need to do any assessments first, and then set our monthly goals for organization planning. And I look forward to it.
Thank you, Mercedes. All right, training, membership, and professional development, Tasia.
Hi everyone, my name is Tasia and I'm the lead for the training, membership, and professional development team. So what we do, we produce professional development for our monthly MHA general body meetings, and that's usually we usually dedicate the first 15 minutes or so of our general body meetings to professional development for our ambassadors. And we also organize and oversee the training for prospective members each fall. We keep updated records in Box, such as membership rosters or general meeting attendance, that kind of thing. So who we are, again, I'm Tasia Williams, I'm the lead. We also have Gabe Green, Sahara Mugnia, and Victoria Gutierrez. Very grateful for their contributions. So responsibilities are to attend the team meetings. Those will be bi-weekly via Zoom. We'll need you to actively contribute to our team activities and communicate with me, the team lead, and other team members effectively. And we usually use GroupMe for that. So just, if I send something, then you would be expected to respond. And we need people to help develop and implement professional development presentations and topics. So what we have done, we are a very new team. Last semester was our first semester. We oversaw training of prospective members. So I'm sure everyone on this meeting who is a new member, congratulations again, has heard from me at some point with the training. And we also did a professional development presentation on setting boundaries, when to say no, when to know when you're overwhelmed and how to handle that. And you can see some of the pictures from it at the bottom of the screen. And all our professional development opportunities are geared towards mental health. So our plans for the spring are, we will be doing professional development at each of the general body meetings monthly. So there are the dates for our general body meetings: February the 4th from 2:30 to 3:15 p.m., March 4th from 2:30 to 3:15 p.m., and again on April 1st, same time. And we will be setting the fall training schedule for our next cohort and planning recruitment.
Thank you, Tasia. Okay, so that's who we are. And so we are so thrilled to, at this point, share with you all of that information and to offer you, if we were in person, we would have our wonderful little certificates that we could hand to you, and you could get great pictures with our esteemed deans and Dr. Kennedy and Dr. Jones, but unfortunately we'll have to just hand you your certificate for being inducted. But thank you for being part, and we are just so thrilled to have you as part of the Mental Health Ambassador Program. And so we are going to invite each of you to go to Canvas and to complete the quiz by selecting your first and second choice for your team. Again, as a reminder, the team expectations are listed here, and we just ask that you put in there which one would be your first choice and what would be your second choice. We're going to leave this quiz open in Canvas until the end of the day tomorrow, 11:59 p.m. tomorrow. And yes, it's a day, 24 hours or a little bit more, but our hope is that we can really start moving forward and getting our teams together. All of you should be added to Canvas shell so that you can select your teams. If for some reason you are having difficulty getting in, just email us after this and we will work with you to get that settled. So we would just like to finalize, as we see at 6:01, and want to respect everyone's time to share with you what the next steps are, and which are, we will have you, after you are selecting the teams, we will work together as a leadership team to make those assignments and then begin having our team meetings. We will have our general body membership meetings as listed here. Tasia has sent out calendar invites for those times. Again, embedded in there will be professional development sessions, and everything will be coordinated around our monthly themes as they are listed here. So for February, Black History Month and Healthy Relationships, March, International Women's Month, Gratitude, Alcohol and Drug Facts Week, and then April, Stress Less Week. And of course, we will have our graduation and celebrations, and we'll have our showcase event. We will finalize our spring calendar by February 4th, centered around this, so that we can have the fun of implementing those. We would like to say, most importantly, we want you, of course, to take care of yourselves, have fun, and come get your MHA t-shirt. We are promised that our new MHA t-shirts will be here tomorrow, and so you can pick those up in student counseling services, and they'll be available for you. And so we are just, again, so very thankful to have you as part of us. We would love to be able to recognize all of our current members and just appreciate you and all that you have done to get us to the place where we are now. And Mental Health Ambassadors is really just this organic program that is been developed based on everyone who is part of our program. So thank you all. And I just will put up here these sort of quotes that Lavonia, as part of when we had our retreat yesterday, opened up with these really great quotes, and thought it would be nice to end on these and just to let you know what an impact you all are making on campus and what is felt. So thank you, thank you, thank you. Dr. Stowe. Did I? Okay, good. Woo. Something happened to my screen. I was like, what just happened? So thank you all. Dr. Stowe, would you like to say any closing remarks?
Just echo everything that you've said, Dr. Lindsay, and thank you all for your commitment and for all that you do for our campus and for each other. We need you and we need each other right now, more than ever. And so I cannot be more grateful for the opportunity to serve and work with each of you, and really looking forward to what this semester will bring as we bring some light to campus and remind people about ways to take care of themselves and each other. So many, many thanks. And
Thank you all.
congratulations. Yeah.
Yes, congratulations and thank you. And if you'd like, just unmute yourselves and say hello. It'll be a big, loud music, but I just love hearing your voices.
Hello.
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 Hi.
Hey there.
What beautiful music. So thank you all. Have a wonderful evening and just rest in what beautiful work that you're doing on campus and making such a difference in so many of your fellow classmates. And so thank you. Thank you.